ask and invite you all to introduce yourself in the chat, and then we'll ask new folks to take a minute to introduce yourself. So we'll take a moment.
Good afternoon.
Hi, everyone. Hello. We're going to get started in just 1 minute as people are entering the room. Zerzazer is bringing us to the 21st century with AI technology. Thank you, Zerzazer.
I am. How so?
I saw autopilot.
Oh, yeah. I attended a meeting, or actually, I clicked on a button that I thought I was reading transcripts for a meeting, and then this just ended up downloading, and I can't get rid of it.
Oh, okay. I thought that was on purpose. I was like, okay, so we'll have the okay. All right. See, that's what happened. No, I'm just joking. Okay. Let's take 1 more minute and we'll get started at 3:35 to allow others to jump in. And so again, we invite you to put your name and organization in the chat. All right, so shall we get started? All right. So welcome everyone to the Health Equity Workgroup monthly meeting. We are so happy to have you all join us at this important meeting in which we're going to be talking about our plans for the coming years. And so we are really happy to have you all join this discussion. Again, I invite you to introduce yourself. And again, thank you for joining us. I'd like for the people who are new to the committee, or if there are others who'd like to introduce yourself, to take a minute and provide your name and your organization. And I should say your why for attending the meeting. So take a minute to introduce yourself. If you want to raise hands, you can, or just jump in.
I can go ahead and introduce myself as a new face. Glad to see everyone. My name is Taylor Palmer, and I am new with the PG County Health Department as an intern supporting the work groups and coalition. So happy to be here and really looking forward to working with everyone.
Welcome, Taylor. Thank you.
I can also introduce myself. My name is Benji. I am also an intern with Prince George's County, and I am as well looking forward to working with everybody.
Great, welcome. And we can call you Benji?
Yes.
Love it. Okay.
I would
All right.
prefer that
Well,
actually.
yeah. Okay. Great. Thank you.
Hey everyone, my name is Ethan. I'm a student at the University of Maryland. I'm the new co-director of a student-run policy group called the Terrapin Think Tank, and I'm here to talk a little bit about the modules that we've been working on for the health equity.
Fantastic. Welcome, Ethan.
I can go next. Hi everyone, my name is Ananya. I'm a medical anthropologist with the George Washington University, and I mostly research around COVID and disinformation, and I'm really excited to be here and learn more about the work that you're doing.
Great. Welcome. Welcome. All right. Anyone else? Any other folks? Great. Well, let's get started. And for the new folks, my name is Phyllis Slade Martin, and I'm the co-chair of the Health Equity Work Group. And Zerxazer, do you want to give a hello shout out?
Sure. Hi, good afternoon, everyone. My name is Zerxazer Coyote, and I am the co-chair for our Health Equity Work Group. Nice to see everyone.
Thank you. Thank you. So in today's agenda, we are going to look at, I'll do a recap of the previous meeting. We're going to have Ethan, as he mentioned, will do a curriculum update on the wonderful work they're doing at the Terrapin Think Tank. And then we're going to spend some time focused on our development of our work plan. As you know, we kind of finished up the previous long-term plan, and as the overall coalition is looking at developing sort of next steps and the strategic plan for the next 3 years, we will do our part to add to that overall strategic plan. And then we invite you all to look at, to share any community announcements, and we will then wrap up the meeting. Okay. So one of the things we decided to do is in each of our meetings, what we will begin to do is to look at our vision. And you can see our the vision of the Health Equity Work Group is that Prince George's County is a place where everyone has equitable access to achieve their full health and wellness potential, regardless of race, color, religion, country of origin, immigration status, class, age, disability, sexual orientation, gender identity, or health literacy skills. We want to make sure that we put this up front so that when we have new people and when we have returning people, that we are all clear and we are all on the same page in understanding what drives us, right? Why do we do what we do? Why do we discuss what we discuss? Why do we prioritize what we prioritize? And so as we go through this year and into next year, one of the things we will do in the coming year is we will also infuse our goals into the agenda so that we have clarity on why we're having and discussing the things that we're discussing. And so I really want to acknowledge Zerxazer for coming up with this concept to make sure we infuse these kind of things into our agenda. Next one. So just a brief update of the previous meeting and a recap of the previous meeting. We had 2 wonderful presentations about maternal health data and programs within Prince George's County. You can hear those presentations and discussions through our recorded link. If you did not receive that or you're new for the first time to the committee, we can certainly send that to you. So that those were the major highlighted discussions from our May meeting. We also had strategic planning discussions, and a lot of the discussion centered around the goals that and the kind of initiatives, steps that we want to take related to the health equity work group moving forward. And so when we get to the goals discussions, they were developed keeping in mind that discussion that we had. So hopefully they adequately really reflect the discussion that we have. And I always like to acknowledge people and really want to acknowledge Kim for the work that she did in bringing together those ideas from the various discussions that we had in planning and in the May meeting. Okay, go to the next slide. So Ethan Adler will now give us some updates and tell, for those who are new, Ethan, if you can just say a couple words about the Terrapin Think Tank and then the work on the curriculum.
Yeah, absolutely. So again, I'm Ethan Adler. I'm a rising junior at the University of Maryland, and I recently took over the role as co-director of the Terrapin Think Tank. And so what the think tank does is it's a student-run policy group based out of the University of Maryland. Last year was our first year, so we're still kind of building some momentum, but we've got about 5 or 6 fellows right now, and we all have our own independent policy projects that we've been pursuing. And of the other things that we've kind of picked up to work on, one of these is the Health Equity Champions curriculum. And so what we have been doing is we've fleshed out kind of an outline for a series of modules for a class for this curriculum. We were given some framework to kind of work off to base the modules off of. And the fellows have kind of been fleshing those out with, research we found, questions that a teacher could potentially lead a discussion with, that kind of stuff. And so that's kind of the current state of where these modules are at right now. We are just wrapping up the outlines, and we're going to send them to the deans of the School of Public Health at the University of Maryland so they can review them. And then we will share them, of course, with you guys and kind of get your opinion on what you think they are before we go and flesh out some of the slideshows, the slide decks, and other resources that would be helpful to run the class. But that's kind of currently where we're at right now with those modules. Our goal for the summer, of course, things slow down. People have summer plans. There's a lot going on, so it's hard to maintain the momentum with this kind of stuff, in June, July, August. But our plan is to keep a slow burn, kind of churning out these outlines and the slide decks. And yeah, I'm hearing static too. I don't know if can you hear me all right?
I can hear you clearly.
Okay. Yeah, I hear that too, but I'm able to hear it.
I think,
but anyway,
it just went away.
The static's gone. All right, yeah, it's gone for me too. But so yeah, we're going to work on finishing up the outlines and the slide deck throughout the summer, and then hopefully by the start of the fall or maybe into the fall, we'll be able to produce a finished product.
Great. Any questions for Ethan? So for those of you who worked on those 4 primary areas related to the Health Equity Champions curriculum, this is sort of our next step with having the students at the Terrapin Think Tank to really put them into bite-sized pieces in which we can actually use, or which can be actually used in training and working with community members. So Ethan, we will probably have a step in which we, as you said, we'll have certainly health equity committee members look at this, but we will likely also have a focus group in which we will engage some others in the community to take a look as well. Thank you very much. Any questions for Ethan?
Hi, Ethan. This is Kim. Thanks again for joining. I just wanted to say if during the development phase, if any questions come up on your end, feel free to reach out and we can make connections with some of the subject matter experts that Dr. Slade Martin just mentioned.
Yeah, absolutely. Thank you. I'm sure questions will come up, so I'll be sure to reach out.
Great. Thank you again. Yeah, let's acknowledge the Terrapin think tank because they're doing this work is really important as we look at one of our signature initiatives. For them to kind of take this time and they are connected with Dr. Latouche Howard or did I get it backwards? Howard Latouche, Dr. Latouche.
You got it right. You got it right.
Yes. And so we are very excited about the work that is being done, and we look forward to what you have to show us in the fall. Thank you.
Thank you very much. I appreciate it.
You're welcome. So we'll spend time now really talking about the work plan goals and strategies and working to more specifically define the goals and strategies. And again, what we have written down is not etched in stone. It is our attempt to bring together the ideas that you shared in previous meetings. We considered some of the initiatives that have been ongoing and that we're building on. And so we will go through these and, this is open discussion. So any comments, thoughts, questions you have as we go through the goals and strategies, we welcome and we see as very important and central to our ability to put together something that is real and meaningful in terms of our next steps. So how many of you have heard of or have used SMART goals, have used the SMART goals framework? So we see a few hands here for those who use the SMART work framework. So, one of the things as we work on our goals and our initiatives for the next 3 years, as we're looking at a strategic plan again that fits in and that's a part of the overall coalition's strategic plan. We want to use, for our purposes, we're using the acronym SMART. And one is, as we are thinking about the things that we want to focus in on, as it ties into our vision and mission of the overall coalition and the vision of the Health Equity Workgroup, we want to be specific as possible, right? So being specific, as it says here, increases the chances that we'll actually accomplish the goals by having sort of well-defined goals. We want to look at who, what, where, when, and why, when possible, right? So, and we want to look at the dates. Now, some things, our dates may be based on fiscal year. Some things will be all 3 fiscal years. Some things will be the first fiscal year. So we'll say fiscal year 1, 2, and 3, right? And then I will say that as we go through our discussion today, we're not as much concerned with the language. We will work through and parse through shape taking the ideas you bring and shape them into the language. But we really want to get an idea of what the priorities are, what your thoughts are on, what we have put together so far, and we can make changes and tweaks as we go along. So we're not looking at as much the specific wording as much as we are looking at the importance of what it is we want to do. We want to look at goals that are measurable. So we want to have criteria for measuring progress toward our goals. Look at what are the indicators that help us decide if we reach the goal. How can we measure the goals? And then we want them to be achievable. And so as we recognize that we are a volunteer group that come together and we do a variety of different things in our day job, as we shape the initiatives, we may say, for example, as we're looking at the Health Equity Champions program and project, we know that, for example, at some point we want to hand that over to an entity that can actually implement the program. And we have some good prospects that we will talk about at future meetings. But we want to look at what is actually what we can attain or achieve. And then we want to look at relevance. So we want to align our goals with the overall vision, the overall objectives of our work group and of the broader organization, and look at what is feasible to some degree, not limiting ourselves, but what is relevant and connected to what we're doing. And then we want to look at time based and look at having deadlines that, again, are realistic for reaching our goals and the related steps to achieving the goals. Any comments, questions, thoughts related to these considerations as we're looking at the goals?
I think we had a hand raised, but I couldn't see whose it was.
Yes, it was me. I just hi, Dr. Slee Martin. This is Caitlin. I just for some reason I'm getting the loudest static feedback from your mic, and it's really hard to catch what you're saying. I don't know if you
oh, you know what? Let me yeah, I'm not sure. I think that might have been the stat that he was hearing earlier. This Caesar, we might have you to see how I can assist.
Did you want to log out and log back in, and then I just continue where you left off, and then when you come back in?
Yeah, continue, and then I'll see if I can get rid of the static.
Okay, sure, not a problem.
Okay, thank you, Caitlin.
Yeah, sorry, I just want to make sure we can catch what you're saying.
Okay, I'm assuming others might be hearing that same static.
Not a problem. Thank you for bringing that to our attention, Caitlin. So in continuing with the SMART goals that Slade Martin had outlined, the next slide talks about some of the goals that we had drafted. Did it go away? Yeah, I think it went away for everyone. Okay. some of the goals that we had drafted as a part of our strategic plan for our work group. And I won't go through every single word in detail, but essentially I will read out the goals. And again, this is an open discussion. So if anyone has, hello? If anyone has any questions or comments, just feel free to chime in. But our draft goal number 1 indicates promote and advocate for health equity for all individuals within Prince George's County by providing guidance and support for implementation of health in all policies. And so we've started to do that with the implementation of the Health Equities program. I'm sorry, the Health Equity Champions program, of which Ethan had talked to us about earlier, providing guidance for implementation of health and all policies based on deliverables from that legislation, recommendations that came out of the RAND report, and the subcommittee summary report that I'll outline in a few slides later in the meeting. And then submit a request to the Board of Health asking for implementation. I'm sorry, asking for information on implementation on next steps. So it's really addressing, how we're trying to reach and maximize on some of these on goal number 1. The second goal for our work group, expansion of interagency, county and state collaborations to address health disparities and promote equitable healthcare outcomes. So this is really a community endeavor. And what more can we do to engage those who really need a seat at the table to address health equity and some of these social determinants of health that um, that we're either aware of or not aware of, and trying to create a more healthier community in Prince George's County. So collaborating with state mandated Commission on Health Equity, engaging with County Council Board of Health, broadening our health equity work group membership. So if you have colleagues who should have a seat at this table and to log on to our meetings, please invite them. Please let them know of what we're doing and the work that we're doing. Inter-coalition collaboration. So there are 2 other work groups, that's HEAL and the behavioral health work groups. And taking a look at how we can effectively collaborate with those 2 work groups and defining some collaborative goals as well. So we all have our each goals that we work through independently, but then how can we come together as a unit and identify some goals to collaborate on. And then we have draft 3, and this bar doesn't seem to want to go away. It says increase reach of public health emergency messaging to at-risk communities. So essentially, how we're utilizing our partnerships to make sure that the public is aware in the event of emergency. So we did that. Or I'm sorry, I think we've done that before with utilization of the ad hoc vaccine working group to identify and communicate with at-risk public during the emergencies like COVID, partner with OEM and PHEP. Kim, what are those acronyms, please? So that
Yes, thanks for
everyone
calling
knows
me
what to
out for
find.
acronym use. The Office of Emergency Management and the Public Health Emergency Preparedness Team, which is within the Health Department.
Great. Yes. So, how we can continue to identify those organizations as resources to help us communicate with the public during emergencies. have a unified public health emergency response system and messaging, and inclusion of health literacy considerations. I'm not sure if Cynthia is on this call, but there is, the health literacy working group as well, that meets to identify and amplify some of this information regarding, how to disseminate messaging um, to the community in an equitable way. I will pause because that was a lot. If there's any questions or thoughts, please feel free to chime in.
And this is Kim again. Just so everyone knows, yes, I think we may have touched on this, but all of these ideas were through the discussion that we had last month. So everyone kind of pulled together. We just kind of reorganized them and grouped them together in a way that fit within specified goals. So thanks everyone for your contribution.
Yeah, that was a really hearty discussion that we had. And these are words that we all came together and created. So thank you so much, and see what happens when we all work together. We do see a hand from Sharon. Go ahead, Sharon.
I just had a question about the goal that's related to public health emergencies. Is it just public health emergencies that we want to deal with? Or because that's a really specific, in my mind, that's a very specific thing where you declare a public health emergency. The government declares a public health emergency. I just feel like there are non-declared public health emergencies in our communities that we may want to message on. And it may be even something like, when data comes out that, you have an increase in some particular area, or, health indicators are worsening or something like that we might want to react to. So I guess I would consider changing the term public health emergencies to something else, but off the top of my head, I can't think of what else.
Crises,
What was that?
crises, like chronic diseases.
Okay.
Can you hear me?
Yes. Mm-hmm.
Yes.
Yeah. Who was that? Amber? Yeah. Okay.
Good afternoon. Just to chime in, I had the same thoughts as Sharon on this matter, because I also think that there is, definitely a blurred line, not a concrete line, between health disparities in goal number 2 and health emergencies. So for our communities, we can argue that, for example, HIV is actually an emergency in Prince George's County, right? For specific populations, we can argue that maternal mortality and infant mortality for women, who do not get access for whichever reason for care while pregnant, right? That can be viewed as an emergency as well. So I was thinking in a similar way.
Mm-hmm.
I just wanted to do a check-in with my static, and also just ask if everyone can mute. That's not. I think I hear some discussion.
Yes. Thank you so much, Phyllis. The static is gone.
Great. Well, you continue. It looks like a good discussion. Continue.
Yeah, Anya and Sharon just made some really great and valid points regarding goal number 3, and kind of altering the language of how we're looking at public health emergencies, of what may of what may constitute as an emergency, and changing that language a little bit. So I think I heard a recommendation of crises, which was a good recommendation too.
That sounds
Yeah,
good.
absolutely.
Are we good with the first two goals? Or can you hear me?
We can't hear you. Yeah,
Okay. So you discussed the first two as well?
we did. Yes. Well, there wasn't any discussion really around the first two, but we went through all three of them. There was discussion around three, just to catch you up to speed.
Regarding the third goal, I think
Mhm.
I think I'm following what everyone else is saying. I'm wondering like what our core goal here, it like our vision for an ideal state here would be. So like I'm thinking, if we are very plugged in and we're good at communicating in a health literate way information to lots of communities, then we will be able to reach them during public health emergencies and other emergencies. So maybe the focus of this goal needs to be more around communication strategies or community networks to distribute information around, in health literate and culturally competent, linguistically competent, all that ways, so that we have that infrastructure in place for health emergencies, but we can do it for also, any emerging health threat, and that we like have those relationships in place.
And I think to get all of these kind of ideas down and thoughts down, and then we can look at how we might shape the thoughts. What are some of your what's some of your thinking, Pam?
I love that. I think I don't have we kind of addressed some of the wording, the specific wording, but I think the idea was to build some kind of communications plan. But I think that addressing it more in the name of public health issues and how to reach the people that might not get the mass blast from the county. How do we how do we make sure that we have resources to get to people in different languages? So I think really helping the county, because these plans exist, but I think that we don't necessarily utilize them on the day-to-day, so that they're not practiced. So when there is an emergency like COVID, we don't really have them ready to go or ready to address the way that people need. So I think that I definitely agree with what Caitlin was saying. And communication recommendations of communication strategies and infrastructure is perfect. I think it aligns great with what we need.
And it's a good opportunity, at least I'm thinking, to incorporate health literacy, which we know is such a huge part of health equity. And back in the day, there was a work group around, but that's a great, I think, way to incorporate that also.
And if I heard right, I think Dr. Bauer had the opportunity to actually take a vacation this week, but I'm sure she'll be glad to hear of all the health literacy talk.
Good. So let's make goals and assign her as the point person for them.
Make sure we're recording this. This is, I'm glad you sort of used that language of health literacy. So, because so much of this concept was born out of why we had a health literacy subgroup, right? So
exactly. Yeah.
Can I also chime in for a second? I enjoyed the conversation about the communication, and it actually made me think about something from a different perspective. I thought back about the 2022 community assessment, which does show where some of the health disparities in the county lie. However, because it really looks at outcomes, one thing that on our side, on my end, as like somebody like who may provide some input to policymakers, one side that is missing is really understanding any changes in our capacity as a county to address any of these health disparities or to meet any healthcare needs in the county, if you see what I mean. So we are looking at the outcomes, right, at health outcomes, but we don't necessarily have good measures for evaluating our county-based capacity to address our healthcare needs. So I thought that communication, that's kind of like a way to mobilize your resources, meaning your capacity. Just wanted to note that on our end, I personally feel like we don't know that much about the capacity. And when we speak about health disparities, and of course with health and health policies where we're like, okay, most of the stuff that impacts health is outside the healthcare, but still, how do we like in a practical way, measure and gauge our ability, our capacity, our investment into all of this matters. So, but communication, I don't know why, but it triggered these thoughts because that's kind of like the glue, because that's how you activate your network, which determines your overall capacity. Thanks.
Great. Great. Vexasia, I want to.
And I think, Anya, you had two questions or a comment and a question in the chat about how we're defining at-risk communities, if they'll be defined in the context of our county, given our disparities, and if the term specific, the specific term health disparities, they'll be identified based on the 2022 community assessment. I don't know, I think this is the kind of the forum to think that through.
Sure. I think that my concern essentially is the typical measures for health disparities, including the ones that are utilized in the assessment. I do completely understand them. However, in our diverse county, we have probably more variation within any given group, as to when compared between the different groups. So I don't know if you guys have come across any really good practices that enable diverse jurisdictions to really use interception of various factors, because it's not just your race that will define or contribute to your outcome. It's also your socioeconomical status, probably like specific name, like your zip code, and obviously like an array of factors. And so far, I mean, we're not unique. We are and we're not unique, but I have not really seen anybody who has developed a more complex methodology that really gets at disparities. Well, anyway, that's a little, but given the complexity of our jurisdiction, I was wondering how exactly are we going to define the at-risk communities?
Yeah, and I think that's something that we can put in our in the notes for us to wrestle with and give people opportunities to share some thoughts on. But as the Vexasia says, we'll not attempt to answer that question today, because as you said, Anya, that is complex, right? So but something we can address and look at some of the previous documents. Kim.
And thanks, Anya. I do think that's a really good point, though. And I think it's something that this document could potentially help us anticipate community needs before people are impacted. So we're making sure that, I know this is, my mindset kind of first came to emergencies. So it's like anticipating the needs before someone is left behind. But if we can also just think of ways to meet the needs of diverse communities and get additional partnership through goal 2 to hear from different people, what what needs might not be addressed that we don't even know about. So I think that they kind of work hand in hand. And if we get more people in, we can kind of build goal 3 even more, because we'll know what the different communities need. And then each problem that we're addressing, at least in the emergency response world, you kind of have a communications plan that's just a all encompassing plan, and you just adjust it based on what you're working with. So as we're looking at different public health problems or issues, we can adjust it to see and use our data to discover who is the current at-risk community and who's facing health disparities based on that problem.
And Anya, as you kind of alluded to, that we can probably find 5 documents, right? And in those documents, it'll have descriptions and definitions and those related to disparities and what they look like. And I think so much of the objective of what we are seeking to do, in line with what you're suggesting and saying, it's what is real on the ground in connection to what Kim just described to. What is real on the ground? You know, what when we look at, for example, some of these maternal health issues, what is real on the ground in terms of the realities that we are seeing and the related disparities that cross socioeconomic and other lines, right? So we will talk about that. Should we go to the next part in which we can maybe talk about any specifics? Again, you know, as we meet, we'll send these out again and ask for some input on tweaking the language. But I do like that discussion that we just had, which really helps get to the real meaning of the discussion. Thank you, Zaza, for facilitating that discussion. Should we talk as we look at this idea of promoting and advocating for health equity and looking at guidance and support for health in all policies? Can we go to the next slide? And Zaza, you want to share some of these things? Now, these are, I think, examples of some of the work that we had talked about earlier that showed up in some previous reports. Do you want to talk about them in any detail, or we can just kind of show these and have them in our notes?
I think in just taking a look, if anyone had any thoughts around some of these action items, that would be appropriate. But I think more so what we're trying to do is, you know, present to whoever also has not heard this information before, to get everyone on the same page, but and then at the same time introduce you know, something that we're trying to, you know, work towards in building our strategic plan. So how we can utilize some of these deliverables and put them into action. Sharon, go ahead.
Oh, I was just wondering, can you hear me?
Yes, we can.
Okay. What is by county government in the number 4? Is by county, BI-county.
That's usually Montgomery County and Prince George's County. That it's to my understanding. So federal, state, local partners.
That's a good point. as opposed to tri-county. Why are we excluding other?
Yeah.
And this is
Unless
not
there's other language that defines that more clearly.
and in a sense, these two, this slide and the next slide is sort of just information from previous work that has been done. I think the next slide is some highlights, and these in some ways relate to or sort of given as an example to relate to I think initiative 2 of this first goal. And it's sort of just to say there are the documents and the deliverables that have been shown in different reports and other work that we have done. And so the next slide is on the RAND report. Kim?
Yeah, I just wanted to clarify, yes, these two slides are both direct copy and paste the deliverables for county council from the HiAP legislation. So we talked about last week just accountability for those efforts, and then just asking what the Board of Health's plan is to address them. So we just wanted to kind of provide them in the slides as a reminder or something that people could refer back to instead of looking up the legislation on their own time. And then Phyllis, like you just mentioned, Dr. Slade Martin just mentioned that this is the subcommittee summary report recommendations. And then here we have the RAND report recommendations. So all of these different resources we used to just considerations for best practices for implementation of health in all policies.
And these are again, they kind of connect with some of the strategies and goals, but just that it's sort of as an example of some things that information that exists. So there are sources that we can pull from. Let's look at this first goal, and don't feel tethered to the exact structure that we have. But let's look at this first goal, and I want to give opportunity for you to just discuss any things that you see or action steps that we should take related to goal number 1. So the first focus that we have here, again, based on our previous discussion, is to look at implementing, promoting, and executing the Health Equity Champions curriculum to service providers, leaders, and residents in Prince George's County. And I would say probably we want to say Health Equity Champions program, right? And the curriculum is part of the program, but we can talk specifically today about the curriculum or the program. So I want to just open up the floor for any discussions on your thoughts about our next steps or actions that we would take related to this, whether it's the Health Equity Champions program or curriculum. Does that make sense?
I almost want to say that it starts a little bit too with the think tank, and what their timeline looks like in terms of deliverable products, and working with them on what that looks like for us. So that comes to mind as one of maybe the initial steps, is to see what their timeline looks like.
So in that regard, we're talking about September. I think comfortably, maybe we're talking about September, sometime in September of of this year to work with them to finalize the curriculum. Now, okay, so let me stop. So because I want to just keep this as what you were doing, Zerzaza, is to get all the ideas down. Yeah, so definitely we're talking sometime in September. I think that he said he would deliver, they would deliver the a strong draft. Okay, other thoughts on the curriculum or the program, and we can parse
I guess
that out.
another question that we would need to work out is who would be actually responsible for delivering the training, and would we want some sort of cohort, model where we had just basically have a plan for implementation and who's on first related
And,
to that.
Yeah, and
Sorry.
Caitlin, that's a very I think that was Caitlin, right?
Mhm.
That's a very important thing. I think to we have but I don't want to announce it yet because I think there are some things that need to be discussed, but we have I don't know what the language is, but we want to maybe formalize. We can leave this identify partners to implement the program as well, but we want to formalize the arrangement to pass the torch in so many words. So there has been expressed interest in taking on the responsibility of implementing the program.
Oh, wow, that's awesome.
And so it will be that we need to formalize that arrangement.
Okay, great.
I guess, yeah. But and I think under that is part of that is to identify those additional partners that would work with the project. So, but that's a good point. Other thoughts on that? Did we hit both of those points that you made, Caitlin? So again, formalize and identify partners to implement the program and delivery.
Yeah, that looks great. Yep.
Yeah. So we've had, it's very exciting, but I want to make sure that I follow proper procedures before I make an announcement. And that I think can probably fairly easly happen sometime in should we say fall sometime in the fall of 2023? Am I cheating by not saying more specifically? Good, Kim, good.
And maybe even, I know we kind of started doing this in the past months, but maybe specifically pulling together an implementation plan. So someone's going to do it, but we'll still have, as a coalition, feedback about the vision for that implementation and who our target or a focus audience is.
Absolutely. Let's keep the ideas flowing. Especially Christine, can I call on you to get any of your thoughts, as you had a lot to do with us, getting looking at this program?
So I mean, a lot of my thoughts have been captured already. Nothing is coming to me just yet.
Oh, that's okay. I just wanted to make sure I recognize your work with this, and back in the day, getting this conceptualized with some work, earlier work.
So my thought too around this would be eh, eh, communication about this health equity champions curriculum. So from our work group, either to the board of council, so I'm sorry, to the board of health, but some sort of knowledge and awareness. I'm not sure where that might fit in early on, maybe, or after we, before we identify partners, or in the midst of identifying partners, but there definitely would need some sort of communication and promotion. Yep, that's the word.
Great.
Maybe also like figuring out if we could offer some type of CMEs as part of doing this, like, or some type of figuring out a way. I think that's kind of part of communication about how to incentivize participation. Like, I think it would be great to eventually make it like a Prince George's Healthcare Action Coalition Health Equity Champion certification type of thing, where they get like, they can add it to their resumes and all that kind of stuff. And maybe like CMEs are a good way to recruit. I know they have a cost associated with them, but it's usually not that much.
Great.
I'm excited.
Great.
What are some other thoughts? Any other thoughts on this as we look at this particular
So actually, Caitlin's question actually raises, or comments, which I love, raises another question. I guess in my mind, whenever I thought of the audience, I always assumed it would be people who are like not the people who are right here in this room. That we'd be intentionally reaching out to others in other sectors, other fields, to be those health champions. So do those, and I honestly don't know, do those CEs and things of that nature have weight in other fields? And if not, we should find out what those other fields are to align.
Great.
Yeah, it's a great comment.
Yeah.
Absolutely.
Yeah.
And and in line with that, Christine, is the idea is really to get people from the community. So one of the things I wanted to add is the idea of having focus group with community, and that may be under one of these, I'm not sure, but to have focus groups so that we can hear the perspectives of the people from civic organizations and other types of organizations. As we were talking about the curriculum, for example, when Ethan was speaking, because we are going to need that buy-in. We're going to need that interest in order to ensure that audience. And so looking at having some focus groups. Given time, I want to make sure that we cover some of the additional initiatives. And what we're going to do is we'll be sending out this out again, and with these additions, and we'll ask for your additional feedback as we go through. Yes, Kim, that's a good one too. Is the idea of the pilot program. Let's jump to some of the others so that we can ensure that we have some notes from another. Yeah. Providing guidance for implementation of HiAP based on deliverables from that legislation that you saw earlier. and recommendations from the RAND report and subcommittee report. So promote and advocate for health equity within Prince George's County. And I think one thing is, and Anya, you might have suggestions here as well, is one is we want to maintain the liaison relationship with the BOH or with the council. They have identified a consultant. But we can put that, but we just want to make sure we have that liaison relationship. And in that regard, one of the action steps under that could be having that person attend the work group planning meeting that take place between with the co-chair, potentially. Other thoughts, ideas related to the legislative piece? Sharon.
Sorry, can you guys hear me?
Still here? No, we couldn't. Go on, Anya.
Sorry, I had to switch to my phone. Just wanted to let you know that consultant is also very interested in cooperating with you guys. And thank you, Kim, for sending me the information. I did pass it to her so that she's aware as to how frequently you guys meet. Well, not just you, but the overall coalition. And also, one of the questions that she asked me is how exactly the Healthcare Action Coalition can contribute or contributes to health outcomes in the county. And so I kind of like told her that, listen, you know, it's here. It's a very active group of passionate people who are interested in improving healthcare and health outcomes in the county. However, how much they can achieve really depends on you know, not just on their enthusiasm, but also on their ability to work with you guys. So, you know, so I think it'll be good for you to think as to how you want to position yourself when you have that conversation with a consultant in terms of what exactly, how do you want to see your role, you know, and your role in partnership with the Board of Health. So you may want to just think about that, how to position yourself.
Anya, can I ask you a quick question? And this may be a kind of like a historical question, but how has the Board of Health perceived our work group or our coalition, I'm sorry, in regards to the relationship with them historically?
In all honesty, it's very difficult to say because, you know, council members, it's very difficult for them to be experts, you know, in all the agencies that we have. And the Board of Health as a body has been relatively passive because it met only like 3 times a year, which is all that's required. They did not hold any active sessions or work sessions in between the meetings. Furthermore, our Health, Human Services and Public Safety Committee has never looked at any health-related issues because they never knew where the work of that committee ends and the work of Board of Health begins. So this new Board of Health is different. And they, you know, like, and that's why they are taking some time to, you know, like to roll out what exactly, you know, like they want to do and how they want to do it. So they have been, you know, like asking questions about you guys, but I would, you know, like, so it's difficult for me to say exactly who thought what in the past because it's a whole new council. You have so many new council members, and they, you know, and as some of you may know, they do position themselves as People's Council. And improving healthcare in the county is actually one of their top priorities. So it's a different, you know, like it's a different group and it's a different day. So I would be more concerned as to how you actually forge this positive relationship, because in the past, I thought that we spent way too much time figuring out how to approach them. That should not even be an issue, because we are on the same side. We want the same things. And what we want to do is how we can be good partners. And that's why my emphasis to the consultant was that, listen, you have like a wealth of experts of all different walks of life, like people who are advocates, people who are, recipients of healthcare, people who are providers of healthcare. You really have such a wealth of resources and expertise at your fingertips. Use it. So I don't think that, so hopefully we will, with a new consultant and new board of health, we will not have those issues of, well, how do we connect to them, but actually how can we actually achieve things by working together and leveraging all of our resources. So that's kind of like my goal and my hope for this.
Right. Thank you for that, Anya.
Thank you. Anything else related to strategy 2? Let's go to the next strategy and spend a few minutes on that. Then we'll go to goal 2. Submit a request to the DOH asking for information on implementation of HiAP. So that may tie in with some of our other goals. Any quick comments on this? Any quick comments on that?
I think just thinking of what Anya just mentioned, I think some of our next steps are just pulling all of these new goals into the community health improvement plan. So maybe we could start by requesting a meeting with either a representative of the Board of Health or the Board of Health to share our community health improvement plan goals so they have a better understanding of what we do. And then we can from there possibly draft a request back to them asking what are they doing to implement health in all policies.
And I think, Anya, that kind of ties into that conversation we had the other day related to connecting and showing up when invited.
Yeah, so one of my questions, I guess, that I had was, is it a stretch, or maybe not the right term, or maybe it is, to be an advisory body to the Board of Health? In other words, we are on the ground, connected in the community, and have that that source of information, and as we're gathering information, to be able to provide and advise to the Board of Health as they're making recommendations or decisions and things like that. I'm not sure if that term has been utilized before, but looking at ourselves or positioning ourselves as an advisory body to the Board of Health, I think would be able to provide some sort of clarity as to who we are and how we can work together with them.
And Anya may want to thank you, Zipsazer. Anya, we had sort of a conversation about this a bit, but yeah. So good, definitely something I think to look at and to explore. Absolutely.
And didn't the RAND report actually reference the Fiji Health Action Coalition as such? I can't remember. It's been quite some time, but I thought that it was, and Dr. Askew's recommendations is, we may want to take a look just to circle back and make it see it's not just us saying this. This has actually been noted before.
Presented before, yeah.
And some of that was started with Sherry kind of going forward to the board, but I think looking into the future, having that in the plan is something to for us to consider. Let's jump to our next goal. and just talk a bit about these collaborations. And I think one of the things that Anya was saying about disparities might fit, looking at some defining and definitions of what we are doing. And again, drawing on some of the reports that have been, some of those definitions and reports that that have been used before. So I'm going to be quiet and just ask if there are thoughts on this particular initiative.
Well, I think since no one else is speaking up, I'll share. I think that we're hoping to plan all of the work groups implementation plans at the September quarterly meeting. So just by, being present and sharing and hearing those goals at the quarterly meeting in September, I think we can get a good idea of what's going on within the other work groups. Alternately, we could schedule a time where our meetings are shared. So we could have a behavioral health equity work group, which I think you've done in the past.
Work group meeting, yeah. And so that's kind of formalizing what we had talked about previously is and Kim and I had a conversation about since our work is health equity, that in some ways we would take the lead in ensuring that those kind of engagements, those kind of conversations take place. And so we would engage with these other groups as we see here with the other work groups, and we would, in a sense, take the lead in terms of ensuring that these meetings take place. So I don't know if the word is initiate or ensure that these collaborations take place, particularly with the other work groups, with the two other work groups.
Did I hear that BHAG on Tuesday that BHAG was restructuring? Because I know we initially had, was it this year? Oh my gosh, I can't even remember. Oh gosh, it was almost a year ago that we did have a joint meeting. Does that have any impact on this particular strategy?
So they're restructuring. I guess that language is really around the rebuilding. They don't have a co-chair identified right now. So we're just kind of trying to make sure that it stays afloat and bring in new partners to get a new idea of what their goals are as well. So all of our groups are in this strategic planning place. So that does make it a good time to say, oh, great, this is the goal you're working on. Have you considered adding steps 5, 6, and 7 to make sure that health equity is considered as you implement those goals?
And I think, Christine, to the extent that we would not put it as a September, we would push the date out a little bit to give time for that regrouping to take place. Anything else with this goal?
I just want to mention the language and information that Anya has put into the chat regarding, who we are and how that could be stated. So that's great. Thank you, Anya.
Thanks for seeing that. I haven't been looking at the chat, so that's great. Let's see, strategy 2. Now, let me say this as my mind has the tendency to want to race through these. let me say that we can certainly send this or a document out for you to, this is kind of our warm up, right? So we'll send this document out for you to think about what would be some initiative that we can do that fit into that SMART goal model as we talked about. And so to maybe give you some breathing room to come up with some more specifics. Our goal is, what is our timeline in terms of getting a strong draft to the umbrella group, Kim? Yesterday? No.
Ultimately, since we're not meeting in July, I think that a lot of the building and development of this kind of happen. And my hopes were that we could kind of, when we come back together in August, do a final review of whatever's developed over time and see if we have any final edits before putting that into a work plan. So I would say by the end of August, I would like to see us have a work plan finalized, at least a first draft work plan.
So let's do this sometime shortly after the meeting. We send it out while things are fresh in people's mind, and we'll pull that together and then send that out sometime before we meet in August to refine the goals and ideas. So we'll go through a process. Is everyone okay with that?
Yeah, that sounds great. I did want to highlight something that I forgot to mention in, I believe it's in the RAND report recommendation slide, as we're thinking about, expanding on some of these goals and incorporating, action steps to them. And I believe it's, oh no, one slide back, might be in the HiAP then. Nope, maybe one further back, sorry. Nope, one more back. Yes. Okay, so in the report recommendations, I wanted to take a look at invest in the future. And initially when I thought about that, I just read invest for the future. I didn't read what was below it. I know we had talked about pipeline programming before, but that invest in the future did not allude to that. And because also my kind of professional space is in education, medical education, I'm wondering if we can still tag on investing in the future, meaning investing in our future X. So whether it's, and since this is HiAP, it's not only healthcare providers, it's not only public health workers, but our future law, our future environmentalists, but investing in those who are coming and paving the way, or creating, the way to carry on this work. So I just kind of wanted to throw that out there just in case, pipeline programming or investing in the future, that language comes about again.
That's interesting in terms of it, even as we look at some of the initiatives around the Health Equity Champions program. I'm thinking how that language might fit in some of that category or beyond. Let me pause here and just again ask if we can just invite everyone to take some time to engage with the goals and to think about, it's almost like we're brainstorming initiatives. We might not be able to incorporate everything, but just, let's think about when you get a copy of this, send us your ideas and thoughts, and we'll continue to work in shaping these overarching goals based on what we've discussed today. and based on what we get from you. And I think we'll be in good shape for August, for that August goal. Are there any comments, announcements that you'd like to make as we are wrapping up? Any additional comments, thoughts, announcements? Pause, pause, pause.
I think one of the things, just as a comment in relation to Christine's comment that she left, it's important to generate ideas to incentivize residents to work in their county. I think internally, we're trying to work on defining the participation and membership for the coalition. So we can keep things like that in mind. I know, defining hours of commitment or just participation in certain events is something I haven't thought of yet, but I think that that's one place. But then how do we then translate that to bringing additional people in and having them be a part of that initiative as well? So thanks, Christine, for that comment.
Yeah, and I think I was expanding even past the coalition, just related more to the pipeline discussion that Sir mentioned, because I know there's a lot of brain power here in the county. There are also a lot of people who go outside of the county to work for one reason or the other. So maybe and it seems like in all different fields. So that's something else to explore. I don't necessarily know that it's our issue, but it is related.
I think it's important to raise all of the different perspectives, for us to think through. Anything else? Caitlin, any closing remarks or announcements?
For once, nothing from me. Thank you.
Thank you for joining us today. Thank you all for joining us today. We will not be meeting in July. Our next meeting will be August 17th. And so we thank you all for all of your contributions and engagement with the Health Equity Work Group this year, and look forward to our continued efforts in the fall. So with that, does anyone have any other comments? Tim, Xerxes, or anyone else? Well, thank you all
everyone.
very much.
Thank you.
Have a good evening.
Have a good one.
Thanks, everyone.
Oh, Anya had her hand raised. Anya? Or you're saying bye?